Mornings with Jones and Tyrrell.
8:30, so 11 degrees, Fort Erie Radio. I'm Brent Jones.
I'm Brenda Tyrrell.
And welcome back to the show this morning.
Happy Tuesday.
Mayor Wayne Redekop is here, return guest, with an update on Fort Erie healthcare. Good morning, sir.
Good morning.
Thank you for being here.
My pleasure.
Have a nice Thanksgiving.
Great Thanksgiving.
Yeah.
Lots of turkey, lots of vegetables from the garden. My family, with the exception of one daughter and her family, were all around our table.
That's awesome.
Got a chance to rest and recharge before getting grilled by Jones and Tyrrell. Very serious morning show.
Well, actually, I had a pretty busy weekend. But I'm here ready to go.
All right. Tell us about Fort Erie healthcare. What do we need to know? What's the latest update since the last time we had you here?
Well, I'm not sure when was I last here.
It would have been right after Niagara Health said they were shutting us down Fridays during the summer.
So June, okay. So just an update, quick update. At the end of June, we made a presentation to the Niagara Health Board of Trustees and talked about our proposal for reimagining Douglas Memorial. And really, it stemmed from a conversation that Chris McQueen and I had with the president of Niagara Health several months ago, where she mentioned that about 130 acute care beds in the hospital system are occupied by non-acute care patients. And so we thought, well, that's the most expensive bed. It's about $1,200 a day to maintain an acute care bed, whereas some alternate level of care bed might be $300-400. So we thought, well, we've got a purpose-built facility in Fort Erie, and it's got lots of space, and we think that we could probably cover at least half of those beds, which would allow acute care beds to be opened up in the hospital system.
What kind of a cost savings does that work out to? I mean, I'm sure you've run the numbers, right?
We have run the numbers. It could be as much as $50 million a year.
So you could save $50 million a year by taking some of those patients to Fort Erie, rather than leaving them in acute beds in the hospital system.
Right. So they wouldn't necessarily save that amount of money, but what they would be doing is they would be making better use of the $50 million, because instead of 130 and then later the number was 145, so it could be a larger number. But instead of having non-acute care patients, and those are typically people who need a long-term care bed, but there isn't one for them to go to, or they can't be sent home because there are no supports there, or there could be a variety of other reasons. So we're providing a solution, and you know, the government of Ontario has made it quite clear that they're trying to reduce hospital services in Ontario. They're trying to make it leaner, although it's far beyond lean. And really what we need is greater services. But we're trying to provide a solution for a problem that exists. So, you know, you've got a hospital system that lost over $25 million last year, or had a deficit of over $25 million. We're showing a way that they can make better use of their money by shifting those beds into a purpose-built facility. And that would be the foundation of our reimagining of Douglas Memorial, because we would primarily want to keep the urgent care center. That's really the main focus, and we need to find a way that we can attract the attention of the Minister of Health to saying, okay, this is something that could work. Aside from alternate level of care beds, we would have some clinics, we would have diagnostics, including a CT scan. So these would be things that would be in Fort Erie. And the other interesting aspect of it is we think that we can utilize the balance of the facility for educational purposes. So we've been in discussions with community colleges that could provide programming to educate the next level of diagnostic technicians or nurses or allied healthcare providers. And the other thing that we're going to try to do is link up with one of the medical schools so that we can get residents coming into Fort Erie to assist us with the urgent care and the rounds for these alternate level of care beds.
Well, if Douglas Memorial was more focused on acute care, you would have to have more of the urgent care services restored, wouldn't you?
We wouldn't be doing acute care. We would be relieving the hospital system of the burden that they're carrying by them utilizing acute care beds for non-acute care patients. So we can let them focus on acute care patients. They can shift their non-acute care patients to our facility so that we can then provide that. But that then saves them money, or allows them to better allocate their money. And it opens up, not only do the acute care beds open up, But if you've got acute care beds available, then the people coming into their emergency departments don't have to wait in the hallways. They can go to an acute care bed. So you're reducing the wait times in the emergency departments. If you've got a better throughput through the emergency departments, then the ambulances aren't lining up in offload delays. An ambulance and 2 paramedics waiting hours and hours and hours. I heard that at one point there were 12 ambulances lined up at the St. Catharines Hospital.
Wow.
Yeah, so that's just unacceptable, and that costs the taxpayers of the Niagara region anywhere from $5 to $8 million. And because half of those costs are paid for by the province, that means the province is paying that amount of money as well.
So we would be more like a palliative care focus with the having all the scanners and everything there?
No, we would be mostly a temporary bed for people who are on their way to alternate level of care, or it could be rehab. It could be people going to long-term care, could be people that are doing rehab, could be palliative care. So it could be a variety of beds, but they're all things that would release pressure on the hospital system.
If you're just joining us, we're speaking with Fort Erie Mayor Wayne Redekop about the sort of the plan or the vision for Douglas Memorial, what the future of that site could look like. Now, I am curious with the plan because yourself, Councillor Tom Lewis, you met with the health minister at the AMO conference, I believe, which was back in August, if I have that correct.
Middle of August.
So has this plan gained any teeth, any traction on the provincial level with Niagara Health? Is there any support for this beyond our town?
Yeah. So after we met with the Niagara Health Board, we've had communication with their board. They seem to be interested in the proposal. They're interested in knowing, so how is this going to work, and what are the logistics of it all? And when we met with the Minister of Health in August in Ottawa, she was very interested in the proposal, and she asked a lot of really good questions. Things like, what about the diagnostics? Are they there? What about the building? And so she's aware of the fact that this is a building that's been, to give credit to Niagara Health, they've maintained the building very well. And because of the history of the building, it has, I believe, 3 separate mechanical areas, the original hospital and then additions that were built on at various times, so that it's really quite functional, and it lends itself to what we're proposing to do. She also wanted to know whether the proposal that we had could be integrated with their primary care physician initiative, which it can be, because physicians can then refer patients. As you know, the large group in Fort Erie is right adjacent to the hospital. So they could take advantage of the fact that the urgent care center is available, that the diagnostics would be available. And usually you're allowed 15 minutes when you meet with a minister at the Association of Municipalities of Ontario conference. We had over 25 minutes with the minister, and somebody kept knocking at the door to tell her the time was up. She kept ignoring it because she was very interested, because, as I said, this is a solution. This is something that no one else has put forward. And after we met with the minister, I had a meeting with representatives from the Ontario Medical Association. They were also very impressed with the proposal. And so we're following up. We've followed up with both Niagara Health and the minister, letting them know that we're now going into the next stages, which is identifying what the logistical needs are. Where will the human resources come from? Where would the money come from? Obviously, the province. And what other healthcare providers would we need? What are the partnerships that we think we can enter into in order to make this happen?
So that would be the next step from here then, right? Is to figure out some of the logistics of how it's going to work.
Exactly.
Have you got any responses from some of that outreach?
We have, and it's been very promising. I can't talk about some of it because a lot of these conversations are confidential in nature, and I can't commit anyone to anything. But we think that there's some excellent opportunities here for us. And sometime this month, I believe Council will be receiving a report from staff with respect to the town hiring a medical systems consultant to assist us to put the flesh on the bones that we've provided.
Very good. This is going to be a good part, I think, to insert just a brief pause. We're going to continue our chat with Mayor Wayne Redekop in just one moment with some questions and answers. Questions, Q&A that folks have texted in this morning. We'll pass on as many as we can, plus a peek at traffic. Don't go anywhere.
Mornings with Jones and Tyrrell.
8:47 and 11 degrees, Fort Erie Radio. I'm Brent Jones.
I'm Brenda Tyrrell.
And we're back here with Mayor Wayne Redekop. Good morning, sir.
Good morning.
Good morning. We didn't put you to sleep yet. You're still
No, still awake.
still bright, sharp, and with us. Now, we baited our listeners this morning into texting in questions with free Meteors tickets. We promised a Q&A with the mayor, and this is all manner of questions here, not just healthcare related.
Does the mayor get free Meteor tickets for showing up?
No. Well, did you text in a question? So you can put you in the draw if you texted yourself a question. Why did I go on this show? Mayor Wayne Redekop, will we maintain our public hospital to benefit all residents, or will we even be able to secure our building from Niagara Health?
So that's a two-part question. And, Niagara Health got the building from the Douglas Memorial Hospital Board, didn't pay anything for it, has had the use of it now for over 25 years. And our view is that hospital should be coming back to the town of Fort Erie, whether through some entity that's created in order to continue the operation of the reimagined Douglas Memorial, or whether it continues as part of the hospital system in Niagara. It should remain a public facility. And if Niagara Health doesn't want it, we do. And, it was created. The original building was funded through the legacy left by William Douglas, Dr. William Douglas. Mm-hmm. And so there's no reason why that shouldn't be a Fort Erie facility. The second part is we envisage that this will be a facility that will be paid for through government funding, and that access to the services will be through OHIP, just like every other service that people have access to. I personally favor the public health system. I regret that some of the decisions by the provincial government have created more opportunities for private medicine that people have to pay for. But that's not our vision. Our vision is that this will be a publicly funded facility. It may have some private service providers, which is what happens now. I mean, when you think about it, many physicians are private corporations, but they're paid by OHIP for the services that they provide, whether it's to their patients as family physicians, whether it's as surgeons in hospital settings, or whether it's individuals working in the emergency department or the urgent care center. They're paid by the government, and people have access to those services. So we're going to continue down that road. That is our vision. How the governance works out is something that we're still going to be discussing with the the Minister of Health. Minister of Health seems to think that Niagara Health has its hands full with the new hospital under construction. Don't know that they want to have Fort Erie's medical services continue to be provided through Niagara Health, but we'll see what happens. And if we have to set up a different entity, we'll do that. It would be no different than the hospital board that existed prior to the amalgamation of the hospitals in Niagara.
So just for clarity, no matter what happens at the Douglas Memorial, your OHIP card will cover it.
That's our vision.
That's the vision. Okay. Go ahead.
Yeah,
Read
just
another
a quick question.
Yeah, read another question.
Could Fort Erie bypass Niagara Health by bringing MRI and CT scan services, reducing wait times and attracting patients from across the region and beyond?
Yeah, so that was something that we've had discussions with Niagara Health about for a few years now, about bringing in a CT scan or an MRI but that would be through one of the service providers that are private. They're private entities. They have a license from the provincial government, and then they provide the service, and that service is paid for by OHIP.
Like so GNMI is an example of something like that?
Exactly.
Okay. Oh, sorry. I thought there was more to the answer. All right, well, let's move on to this one here. Here's a question for you. Has anyone ever told you look like the crooked senator played by Dick Smothers in Casino?
Haven't seen the movie, and I remember Dick Smothers, but the answer is no.
No one's ever told you that?
No.
Well, you do, sir.
Because somebody told us that, asked that on the text line this morning. So me and Tyrrell looked up the photos, and we're like, "Oh my God, you do look a lot like Dick Smothers from that era." That is true.
So if you ever want to go under secret identity, you could just tell people you're the senator of Nevada.
Yeah, you could try.
Yeah.
Cool. Well, not sure that I want to be any American senator or any American anything right now.
Here's one. Why didn't you run at the Crystal Beach 5K on Saturday?
Well, I haven't been doing much running for the last couple of years. I run in fits and starts. I actually ran a little bit yesterday, or as I told my daughters. I quick walked. No, none of the walkers on the Parkway passed me yesterday, so that was good.
Good news.
So I'm not in very good shape right now. I'm going to get back to it, but that's why I didn't run. I did help to sponsor it, and two of my daughters and a grandson ran the 5K, and the other grandson ran the 1K.
Oh, that's
Now,
good.
speaking of running, I would feel remiss if I did not hint.
Oh,
Do you have
running.
any
Oh,
other,
I see where
do you
you're
have
going.
any other
Running.
running
Are
plans?
you running for anything else in
for the town of
2026?
Fort Erie,
Yeah.
Let me just say I'm getting in shape.
Oh, I feel like we just got a clue here.
whoa.
We got a clue. You guys are paying attention. Okay, last one, and then we got to move on. And this one, I apologize. I'm going to read this one the way it's written, and it is. I feel bad saying this, but it's borderline illiterate. Okay, but I'm going to do my best. All right. So, I wanted to give the mayor and his team the chance to come forward with the plan. A month later, he is still hiding it. We met with MPP Wayne Gates. He did not know about this plan. No one is part of making this plan except the mayor. Please ask him what he is going to do with chronic care beds and what he is doing with palliative care beds, books, clinic, etc. Selling out to private companies for profit, we will be one of the first in Ontario. There's a lot to unpack there, so let's just end on that one. If you can.
Well,
your best.
first and foremost, to suggest that Wayne Gates isn't aware of the plan is pretty startling.
Mm-hmm.
He has a copy of the proposal that we delivered to Niagara Health, as does the MP and many other people, including, and I don't know how often I've spoken about this proposal at council meetings, at the media event that we had when the hospital announced that it was going to be closing our urgent care center on Fridays during the summer. I've written about it in an article in The Observer. I've spoken about our attendance at AMO with the minister, so that this proposal, I think, is fairly well known in the public at large. And as I've said earlier this morning, our view is that this would be a publicly funded facility and that it would provide health services to individuals with their OHIP card. It may be that some of the service providers will be private entities, but that's part of medicine in Ontario right now.
But to be clear, coming on the show this morning, you're not hiding the plan. I feel like you were pretty transparent about what the plan is, right?
Well, there's nothing to hide, and in fact, it's important for us to make sure we get that out there. I've met with SOS, Fort Erie
Healthcare SOS, yep. Heather Kelly, yep.
And I met with their board probably 5-6 weeks ago, just to go through that with them so that they're clear on what it is we're doing. They're fully supportive of it because they see the benefit that this could provide to the people of Fort Erie. I mean, we're in a struggle. We're in a crisis situation to make sure that we can continue to have urgent care in Fort Erie. And, just to be clear, the primary care initiative of the province is not urgent care. There's a big difference. And in Fort Erie, if you don't have a family physician, you need urgent care. And even after the family physician's offices close at the end of the day or on the weekends, you need urgent care. So we've made that quite clear to the minister. But no, I'm not hiding. There's nothing to hide. I'm very proud of the fact that we've come up with this proposal and that we're making sure that as many people as possible know about it. And if there are better ideas, if there are things that we can add on to this proposal that we believe that we can market to the Minister of Health, we'll accept that. And but I think it's a pretty extensive plan and proposal. And the notion that we're trying to hide something is, I guess, laughable.
Yeah.
I'm sure Wayne Gates just wasn't aware of this person's interpretation of your plan. He knows what your plan is, but this version of it was probably news to him.
Yeah, well, we live in an age of a lot of communications, and some of the communications are accurate, some of them are inaccurate, some of them are intentionally inaccurate. People have agendas. I have an agenda, and it's to reimagine Douglas Memorial, and I've made that as public as possible.
Well, we love it, and we appreciate you for that, and good luck with it. We did get a person who texted in your defense. That other person, they just said, tell that person who texted in the question about you hiding the plan to I believe that's get effed, I think is the most
Yeah,
polite way I
yeah.
can say that. Anyway, thank you for being on the show this morning. We appreciate you chatting with us.
Yeah, thank you very much for having me.
Thanks for coming on.
Come back anytime. We appreciate it. Hey, local news, sports, and weather coming up at the top of the hour and then into the 9 o'clock hour. It's National I Love You Day. Did you know this? National I Love You Day.
Wow.
Wow. I love you, Brenda, too.
I love you too, Brent Jones.
We'll get into that coming up. Don't go anywhere.
Mornings with Jones and Tyrrell. Weekdays 6 to 10 a.m. Only on Fort Erie